Rocky Dawuni visits Apewosika, Kekem, Axim in the Anta East District of the Western Region during a free health check program organized by Tullow Ghana Oil Limited. Impoverished and located in the interior part of the Anta East District of the Western Region, hundreds of people from Kekem Apewosika in Axim were highly honored and in dismay when Ghanaian reggae superstar icon Rocky Dawuni paid them a surprise and heartwarming visit during a free health check program organized by Tullow Ghana Oil as part of efforts geared towards honoring their social and corporate responsibility. Highly enthusiastic and full of praise to the organizers, the beneficiaries were checked for diabetes, glaucoma, cholera, tooth decay, breast cancer by health professionals, which included doctors, dentists, midwives, eye specialists, ear specialists, nurses, and HIV screening counseling personnel. Free medications were given while very serious diagnosed cases were referred for further checkup and treatment. Corporate Social Responsibility and the program's manager for Tullow Ghana Limited, Ken Adjei, said similar programs have already been organized in other interior and impoverished communities. He expressed his gratitude for the role Rocky Dawuni played making the project a success. On a free health check program, he said, it's just a way to make sure people from the impoverished community like Apewosika can also benefit from the oil revenue.
We just came here today along with our partners from Ghana Health Services to offer some basic health checks and screenings to this fishing community. It's just a way, to make sure some of the investment from the oil money goes into communities like this so people can at least have a better sense of their health status, so the authorities in the health sector can have a better sense of what the health concerns are, and importantly, so we can make sure that some of the money is put into the community in terms of providing necessary pharmaceuticals, necessary treatment, referrals of special cases, and just to give people a sense that someone does care about their health.
Ghanaian reggae superstar icon Rocky Dawuni, elaborating reasons for his visit, said it was due to his commitment to social issues, stating the project was in the right direction. Impressed, he said he hoped the project would be expanded with time, stating the sensitivity of the community within the oil drilling zone needs to be acknowledged by Tullow and its Jubilee partners, of which he said he was engaged.
I feel that it is a step in the right direction, and we look forward to more of those, and we look forward to investment and partnership with the people, and helping the people realize every aspect, expanding it to other aspects like education, and ultimately investing in the people who are what is most important, the most important resource in Ghana, which is our people.
He advised Ghanaians to be ready and to be objectively educate themselves to know how to manage all the expectations involved.
Obviously, development also comes with all its issues and problems, So we just have to be ready and get ourselves educated as to how to manage all of this. And in doing so too, manage all the expectations too, because that is another important thing. And if we can do that, I believe that we will be on course to be a nation that really stands on the side of its people as we progress.
Physician at the Efian Kwanta Regional Hospital, Dr. Anthony, hailed the organizers for exposing them to such an acute zone within the confines of the Western region. He said most of the reported cases diagnosed were easily manageable and treatable cases which could have been corrected medically, but due to the lack of health centers, many within the community such as Apewosika suffer the consequences.
I'll say it's instructive to know that sometimes there are simple things that can be diagnosed and treated, particularly tuberculosis of the bone, of the spine. Like this lady here, you see she developed this swelling at the back, which is a protrusion of the bone. That is the bone angulating at the back. About 6 months now, and she's been round, walking around, and this is just tuberculosis of the spine, which is treatable. So with this, if it's not picked up, she may end up not walking at all. For now, I'll say Tullow is doing well, and they should keep it up. They should look at areas where they can help the citizenry. Not only healthcare, but other areas like building school, infrastructure, and other areas they think they can support. But where they've started from and where we are heading, I think they should continue with the partnership with the Ghana Health Service and the health sector as a whole.
Surviving, the master plan. Surviving, surviving now. Come on, people, meditate, go higher. Ghana people, make you take it, go higher. Come Africa, make you light my fire. And I'll be